Americans, when we ask them what is their number one concern, it's not dying, it's not money, it's losing memory. So we need to talk about it. We need to see what we can do to minimize the risk. We are all at risk. The presentation was supposed to be for 1 hour, but Sister Dina asked me to limit it to 30 minutes, so I'll try to squeeze everything down. So if it is good, it's because I'm good. If it's not good, you know who to blame. Bismillah.
Do you happen to have a microphone with you?
No, you don't have a microphone. Sorry.
There is one.
Can you hear me now?
Yes.
Okay.
Bismillahirrahmanirrahim.
Bismillahirrahmanirrahim. So, it's a non-specific term. Like you have fever. Fever can be due to many different causes. Like you have headache, it's for different causes. But dementia also has over 100 different causes, but the vast majority, 60% or so, are related to Alzheimer's disease. About 20% are called vascular dementia, related to different problems like a stroke or high blood pressure and things like that. But the majority, as I said, is due to Alzheimer's disease. So what is dementia? It's a condition that includes memory loss, difficulty in speaking, difficulty in thinking, that is cognitive processes, all leading to impairment in activities of daily living, your daily life. So the ABC signs of dementia: A, inability to perform activities of daily living, like changing your clothes and simple things that you want to do. Sometimes even in the late stages, they're not even able to feed themselves. Second problem they have is behavior changes. They may be socially withdrawn, lose interest in doing anything. They have changes in their mood. Third thing they have is a cognitive decline in their cognitive function. So they have difficulty in making decisions, difficulty in calculating, problems recalling the right word at the right time, and of course, remembering names. And lastly, it is disorientation. They are confused. They don't know what time or place they may be in. So those are the ABCD signs of a dementia. What is the incidence? And overall, by the time you get 65 years of age, about 5% of us will have some degree of dementia. By the time we turn 80, it's up to 20%, one in 5. And the right graphic shows the incidence according to your gender, and unfortunately, females have a significantly higher risk. And by the time they're about 80 to 90s, females 12 to 8% males. By the time they're close to 90, about a third of females, about 20% of men have dementia. So significant numbers, and unfortunately, as the population is aging over here, the numbers are going to go up dramatically. What is the burden of dementia on individuals and, more importantly, on society? Dementia is the 6th leading cause of death in this country. It contributes to 1 in 4 hospital admissions, 25%. So it's a significant risk, significant burden in the hospitals. And the combined social and healthcare costs are more than the combined cost of stroke, heart disease, and cancer. Imagine, those are big, big problems, but dementia has more than the combined risk of all those 3 major categories. So it's a major burden on the healthcare. What about cost of care for individuals? In Illinois, the average cost of nursing care is anywhere from $6,000 to $10,000 per month. Average stay for a person who ends up in a nursing care is about 2 to 3 years. Eventually, for most of these, when they die, the total cost may be up to $360,000. Medicaid covers some types of nursing care, Medicare does not. So it's a significant burden. Blood tests being marketed, they're just coming in the market, which they look at the ratio of these two proteins in the blood, and they are pretty accurate, able to identify more than 90% of cases, and with a good positive predictive value that you have Alzheimer's, dementia, the brain is kind of shrunk. It's not expanded all the way to the skull. And the ventricle, the tiny cavities that we have in the middle of the brain, which are normally that we have, in cases of dementia, Alzheimer's, the brain is shrunk. So the cavity is not increased because of pressure with them, but because of the brain being shrunk, they are expanded. So you can see in the lower graphic that the ventricles are enlarged. All signs of loss. Explanation of brain structure and functioning. Before we talk about that, since memory loss is the most prominent symptom, it is the most prominent complaint of these patients. Dealing with how memory is stored is critical before we can talk about how we lose it. So briefly, I want to mention how we store memories in our brain. There are different types of memories. Sensory memories, of course, whatever we smell, taste, feel, hear, sensory memory. Then we have what we call a short-term memory, and that is related to things we want to remember for the day or the next few days, some things like a to-do list that we don't have to keep it for the long term, and that's called a short, that deals with actual items. And number two, procedural, whatever procedures we do physically with the muscles. Talking about factual or semantic memory. Anything we come across, whether live or inanimate, any object, a cup, whatever we come across, in this case, came across my grandson. So any object we come across, the brain tags it, labels it with three things. Who is it? What is it? Where is it? And when did you see it? So everything we come across, the brain tags it with those three things. Could be humans, could be my favorite car, could be my favorite pet. Everything is labeled, and all those labels, those tags, are stored in a sequential fashion. For those in computing, it's like an array, built a data array. And in this case, there is 3 dimensions, what, where, when, but there are multiple dimensions I don't need to get into, but that's how all those memories are tagged, labeled, and stored. Amazing, the capacity of the human brain to store. 2.5 million gigabytes. That is equivalent to 2,500 average size computers that we have. 2.5 million gigabytes. A huge memory capacity. The procedures that we do, walking, talking, eating, swimming, driving, whatever procedures that we do is not something related to any item. It's a child, a toddler, learning to walk. See how all the steps are so tentative. The balance is not clear, steady. and the child has to look where to step in. So everything the child has to think and do. But by the time the child has learned to walk, now he can walk, not even without thinking. We can be on the phone, we can be talking with our friends, but we are walking automatically. So how does that happen? When we decide about walking, we send a signal to the motor cortex, and it also coordinates with the visual cortex, which tells the muscles where to place your step. So with repetition, this cycle, this neural circuit gets imprinted on the brain, like on a computer chip. The circuits are printed, circuits are imprinted on the brain. The more you do them, the more intensely you do them, the more permanently they're imprinted. You start doing them gradually with time, those of the brain. Very grossly, these are the different areas involved, but what concerns us is the middle area, the hippocampus, amygdala, which is in the temporal lobes around here. That's where the memory processes mostly occur. The most important cell in the brain is the neuron. In fact, I think that's the most important cell for every one of us. That is the thinking part of your brain, the cell that is involved in all your thinking, processing, everything that we do is all, bottom line is done in the neuron. We all have about 100 billion neurons in our brain. 100 billion. The neuron has a body. I'm not sure which is it. Okay. Where all the processes occur. It has short. It's not going to work. Let me see this. You know how many entries there are? 767 million. And if you squeeze all of them, what is the most important word that comes out? Synapse. The junction between one neuron. But more importantly, maybe if we could regenerate, a term that we use now is neuroplasticity. We can mold the brain to develop those pathways, those neurons, those synapses again, to get the circuits again, to regain the functions that we lose as we age. This graphic shows the number of neurons and synapses as we grow. After birth, there is an exponential increase in the numbers. The black line shows the neurons going up to 100 billion and then a gradual decline. I'm sorry, and very rapidly going up. Synapses, again, peak. Each neuron has 7,000 synapses. So the total number of synapses is 600 trillion. But early on in life, when the child is learning to walk, talk, and everything has to do, the number may be up to 1 quadrillion synapses. A number that I just can't fathom. Within that brain, 1 quadrillion collections that Allah subhanahu wa ta'ala has made. Everyone connecting to the right place to do all the things that we do. Imagine putting 1 quadrillion collections together. Subhanallah. But later on, as I will mention, unfortunately, the synapse numbers go down, and we'll talk about why that happens and how we might minimize that. And if you do a microscopic section of the brain, early on there's very few neurons and connections, synapses. By the time it's a toddler or so, the brain is packed with the neurons and all those connections. What happens by the time we get to middle age? We have learned all the things